on right now. Hopefully we have a few. I sent out. Oh, yep, we've got a few on. Welcome everyone to Health Tie for July 9th. I'm really pleased to have Alaina Gallaher with Dose Health here today to present for us. While we're gathering and kind of coming together, remember to mute your mics if you're not speaking so we don't get any background noise or kids or dogs in the background. Alaina's going to present for about 20 minutes and then we'll have about 10 minutes for question and answer. But before we do that, both Kim Champney and I have a little bit of information we'd like to share. So I had just kind of shared this, but I'm going to share it again. On July 23rd, we're going to kind of step out of our normal format and actually do just kind of a networking event. So often people are coming and they're hearing the presenters and things like that, but we haven't heard from you for a long time. And we'd like to have everyone introduce themselves and then share with us what their updates are. And then we'd like to look for ways that we can support one another and possibly collaborate. So that's, so please come on the 23rd. It was super fun right before this call got started to hear everybody talking and chatting. I'd love to do more of that. So, but Kim, you have something that you wanted to also share with the group?
Yeah, there is a national prize challenge that has just been announced by the Administration for Community Living. I attended 2 webinars this morning on this, and the goal is to create an app or a user-centered designed platform that will allow an assessment, an individual assessment of either an older adult or a person with a disability, potentially a veteran, and based on that assessment, will match them with opportunities to address social isolation. And so whether that's like technology that could help them, training, and then there's all sorts of online classes that are going on, and everything from yoga to travel, and also local in-person activities. And so tomorrow at noon, there's a brainstorming session. This University of Fairbanks Center ICE is interested in partnering with us along with Health Tie. There is a global hackathon that's just been announced that we thought maybe we could have an Alaska team working on this project, getting the mentorship with the global hackathon. Potentially, I put out the word to places like Disability Cocoon, that has been a partner with Health Tie. And I think because we have Health Tie and we have these partnerships between our entrepreneurial and our tech community and our human service provider community, that's unique. That we really are in a position to take this to the top level, which the prize is $500,000. So if you're interested and you just want to learn more, please email me and I will send you the Zoom link. I don't think you can copy and paste the Zoom link out of the chat, or I can put it in there, but you can email me and I'll email it to you directly. Tomorrow, noon.
Awesome, thank you. And really, this is an all-call brainstorming session right now. So anybody, Alaina, if you know anybody who would like to be part of this effort, just let us know. But what I'm going to do now is quickly turn this over to Alaina so she can tell us more about Dose Health and the Dose Flip and all the other services that they provide.
Wonderful, well, thank you. And that is really cool that you guys are looking into doing stuff like that. I think it's awesome. I'll kind of brainstorm and see if I have any connections for you. So a little bit about Dose Health. We are a Minnesota-based company, so we're a little bit south from you guys. But we do provide services to really help people increase or maintain their level of independence. We really started the company with a focus on medication adherence. And so we have some technology that focuses on how to properly manage medications and helping people get on track and stay on track with their meds. But beyond that, we've actually added other services to kind of fit into that independence piece from, I think you guys are all familiar with the help I've fallen and I can't get up buttons, the personal emergency response systems. We specifically have portable ones that allow people to leave their homes to access the community without needing to have a cell phone or any sort of landline or Wi-Fi service. They don't need a base station. It's all built directly into the device for that. Really, again, our goal is just being to promote that independence and that community involvement or just feeling like an individual is more in control of their health and safety, or different aspects of their lives. So I'll probably focus most of the time on the medication dispenser, because I know for the most part people are more familiar with the personal emergency response devices. But if you guys do have questions about those at the end or throughout, I do have the chat pulled up, so feel free to submit anything and I can try to address it while I'm talking. So I'll talk a little bit about medication adherence, because it's a pretty big issue and really cites to why we started the company. It's what the New York Times has called actually a hidden epidemic, because it is something that is unfortunately killing a lot of people that shouldn't be. It's about 120,000 deaths in the United States every year that would be preventable if people were given the right tools to manage their medication. So a little background of how we started: our founder is a medical doctor. And while he was in medical school, he was noticing that he was seeing a lot of the same patients being readmitted on his rounds. And a lot of times they were being readmitted because they weren't taking the medications that they needed to in order to stay healthy. So he was, obviously as a med student, observing the other physicians that he was with and seeing that a lot of the times when they just asked the question of, oh, do you take your medication on schedule? People would just say yes. And so the doctor's response to that was to prescribe them more medication. And so he started calling it the prescription problem of taking, patients they want to do good by their doctors. So they say yes, they say that they're doing that. And maybe they think that they're doing better than they are. But he really realized that this idea of prescribing more medications when the lab results are clearly indicating that this person's not having effective medications, that the answer is not that, oh, medications just aren't processing, we need to up the dosage in every single person they see. He wanted to look into if there was anything that he could offer to his patients in the future that would give them the opportunity to more successfully manage their medications. So that's really how he came up with the idea of the dose flip, which is this little guy. It's our medication dispenser. It's fully automated. So you set an individual's medication schedule on the device itself, and then at their scheduled med times, it's going to automatically open up to that one particular compartment for those medications. And it sounds a series of alarms and flashes light at them just to indicate and remind them when it's time to take their medications. Kind of another thing that influenced in the background of how we designed other parts of this device is he actually, at the same time that he was going through medical school, his grandmother was kind of nearing her end of life and going through transitional care. And it was really, really difficult on his aunt, who was her primary caregiver, to serve that role of trying to manage her medications, make sure she was safe, but also living her own life. Oh, that is so cool, Marco. He said that his dad uses the exact medication dispenser. That is incredible and so cool.
Sorry, I have to
hope
say
it's going well.
It's going well.
Very cool. Well, thank you for sharing. And if you want to share any stories or anything, I would love to hear them. And
Sure.
honestly, even if you're like, oh, this part of the dispenser isn't great, I can always learn from that and make it better. But very cool. Yeah, so Marco, then one of the things that we really focused on in designing it was actually having that caregiver involvement, and with the goal of giving the caregiver essentially, instead of having to drive the car, is what we say, and being the person to call them up excessively, hey, did you take your meds? Did you take your meds? Why haven't you taken your meds? They get to be on the background and step in when the person hasn't taken their medications. So it can generate out notifications to a family member or a caregiving team to say hey, it's been 30 minutes and so-and-so hasn't taken their medications yet. Allowing that caregiver to step in when necessary, but really giving the control to the person on the front end of that. So you still have those safety checks, you're still involved, but ultimately the independence and the control is on the individual themselves using the service. So that was really our big goal when we started out using the device. Actually, initially when we started out, we were aiming for about an 80% adherence rate. That's, by United States standard, that's what's considered adherent, is once you get 80% and above on your medication schedule. When we first started out with our test users, we were really floored. We were at 96%. We're oh, this is a fluke. There's no way. And now we're at, I think we serve a little under 2,000 individuals, and we're at 95% for average adherence rate. So It has been really, really incredible to see how effectively people have been able to use this. We've actually had circumstances too where people have come down. I think the one that somebody reported to us was they had 35 prescription medications, and it was that prescription problem where they just kept getting prescribed more and more. So once they got on our device and started taking medications regularly, they cut that down to 12 prescription meds. So it was just incredible to see that. We've always said, like, our goal is to get prescriptions and medications under control. If ultimately somebody is using our device and then they transition off of it because they've successfully gotten on track with their medication schedule, that's a win for us. We don't want them to be lifelong stuck using this device unless it is the tool that keeps them effectively managing their medications. So yeah, that's really what we aim to do. In the background with that data that we have, it's really, really fascinating. We can see a lot of information about the behaviors of people around their medication schedules. We can see the exact time that they take their medication and dispense it from the machine. We can see information like if somebody is maybe, there are concerns about prescription abuse. We actually have sensors that can alert out if somebody's removed the lid when they're not supposed to. So while the devices are lockable, so this one, for example, is locked where I can't unscrew that lid to access other medications, there is a lid sensor built in that could alert out to the person who's filling my medications for me, saying that the lid has been removed. So if they're not the ones out there filling the medications and they get that alert, they know somebody's doing something they're not supposed to. So it's actually given us a lot of access to be able to support people in lots of different spaces where there are controlled medications or concerns, or even just that confusion piece where maybe we start out, we leave it unlocked, and then suddenly we're seeing that somebody's taking the lid off more frequently. It's just been really fun to see the data, and because we have that data, we can share that with different teams. So on the disability side of things, what we've been seeing a lot.
Alana, are you still there? Oh, we froze a little bit. Alana? Uh-oh.
Sorry, am I back now?
You're back now. You might have to repeat that last little bit.
Yeah, sorry, my computer just suddenly bugged out and kicked me out of the meeting. I think the last little bit that I was saying is on the within the disability population for the individuals that we've been working with, even if they are in a residential setting, we've been seeing some really amazing successes with this technology in increasing an individual's involvement with their medication passing. In the state of Minnesota, we actually talked with our Department of Health and Human Services, because one of the things, since we do primarily work within the Medicaid waiver population, our goal being that the services are not something that, like cost of service is not a barrier for somebody who normally couldn't afford it. We really want the services to be accessible to everyone. So we generally look into having that waiver approval for different states that we work within, which I'll come back to a little bit on what I found when we looked into the Alaska coverage. But at the Minnesota level, we actually had our Department of Health and Human Services basically make a statement that they're really behind assistive technology like this, and that they're encouraging residential providers to start implementing it, and it can still be paid for through an individual's state-covered service program, even if they're in a home that's already being paid for doing med administration. And the reason for that is having that individual be more involved with their care. Not only is that helping the individual, take control in their lives, but also it's been de-risking the medication pass for them, because by having somebody pre-fill the medications on a more set schedule, not while they're also doing other cares, and like with a regular med pass, you have so much room for error, because I actually was a DSP in college, so I can speak very clearly on how stressful med passing was. There's so many things you're juggling during that, and like medication is so crucial and so important. You're trying to focus all of that, but at the same time, at least in the home I was in, we had to make sure that somebody wasn't falling, somebody didn't have an accident. If we heard that somebody was getting upset, we had to address that while we're in the middle of doing med passes. So there's so much room to get distracted and potentially have an error. So essentially the idea is having a designated person fill the medications at a designated scheduled time prevents a lot of that distraction away from the med passing to decrease the risk of error. And now since it's prepackaged for the staff, administering medications and having the individuals involved in that med administration really removes a lot of that risk for misgiving medications, and it cuts down on time. So the staff have more opportunity to actually spend time with the individuals doing things that bring them joy and bring them excitement. So it's been really cool to see that use in the disability space. We've had a lot of really fun stories from people who've utilized the technology and giving us the feedback on how it's helped them, how it's changed their lives. And yeah, we've actually had people move out of, like, we call them group homes here in Minnesota, but moving out of a group home into their own apartment in the community because medication management was the thing that was difficult for them that they relied on staff for. And the staff worked for a couple of months with them on transitioning to the device, and then they were able to move out into their own apartment. So that was just really cool. And honestly, that, when I say level of involvement and independence, it doesn't always equate to that. We've had people who their staff do almost everything for them. We've actually got this really nifty, I'm going to turn this down here, basically adaptive flipper, so that the device can be cradled in here. Sorry. There we go. Cradled in here. So if the individual is going to have a harder time picking up and flipping the device, the staff can set it up in this adaptive flipper, and then the individual can just knock it over and self-administer their meds, which we've actually had pictures sent to us from staff, like just showing how excited, like the big smiles on people's faces for getting to administer their own meds. Because for a lot of the individuals that are supported in those settings, meds have been something they've been taking their entire lives, and not really have they been given the opportunity to be in charge of it, or maybe they've lost that opportunity over the years. And so regaining that control is really exciting for them. So it's just been really fun and wonderful to see that. I want to leave time for questions and see if there's anything that I missed that you guys really wanted me to address. So I'm going to open it up to you guys at this point.
That's wonderful. Yes, does anybody, I always have questions, but is there anybody on our call right now? I mean, yes, Marco, please.
So real quick one, and you asked for feedback. We love it, but and maybe I missed when you're talking about the packaging of the meds inside the device, because my mom spends a lot of time at, on a Sunday to set it up for him for a few days, right? And have you thought of working with PillPack, for example, where they just come in bags and you just put the whole, whatever, the mix of medication? Because my dad takes many medications, and it's unfortunately taking a lot of time for my mom to do it. So maybe I missed that part because I did have an interruption in the network.
Oh yeah, no worries. You didn't. I didn't address that,
Okay.
so I'm glad you asked. We have looked into that. We've actually talked with different pharmacies too in the areas that we're serving to see if they would even be willing to pre-fill medication trays. We've set up a number of people on the Medicaid waivers who the waivers are paying for them to have PillPack, and then they just do that where they dump it into their. It's not a partnership that PillPack has been interested in with us. It's a partnership we'd be very interested in, but ultimately our big lofty goals as a company in really addressing that medication adherence problem would be to essentially fill in the gaps at all ends of things. Is we would love to have pharmacies filling the trays and then shipping the trays out, so that issue of like misfilling potential is removed.
So maybe I have an idea for you. You may know another startup from Florida called Genius RX, who's it's founded by the previous CEO of MD Live, Randy Parker is his name. So he's a close buddy of mine. Genius RX is trying to compete with PillPack. So if you'd like to connect with Genius RX.
Yes, I would love to. I think that sounds amazing. Okay, Genius RX. Marco, do you mind if I follow up with you after this?
Sure. We can take care of that later. Yeah.
I just want to say I love this. This is exactly what Ty is supposed to be doing. So thank you, Marco. But I will absolutely, I can connect you by email after this call, Alana, okay?
That's wonderful. Thank you.
Super exciting. So, I mean, one of the things that I'd like to know from our community is, do you know anybody who would be interested in maybe piloting the dose flip at their organization? So is there anybody online who might be interested in doing that, or maybe you know of somebody? Just putting that out there.
Oh, Jerry, go ahead, Jerry. We can't hear you.
Maybe, Kim, you go ahead and then we'll get Jerry Jenkins back.
Yeah, well, I was just curious, Alaina, you had said you had done some research on Alaska and if this would be a covered service in some way. I'm curious what you found out.
Yeah, so unfortunately what we were finding for the Medicaid reimbursement for medication dispensers is it really doesn't exist for smart pill boxes. What they found is there's an allowance of $65 every 2 years. So only a one-time payment of $65, which our services are $60 per month. So that wouldn't cover much for 2 years for an individual. What we did kind of talk about is, I think that a lot of the times with stuff like that, it's just that that technology wasn't around when they wrote the rules. And so it's just really having a conversation with the departments to see if they would be willing to change it. So Jacqueline and I actually talked about this a couple of days ago when we found that information, and thought that if any of you guys do have suggestions or recommendations of people that we should be reaching out to have those conversations, we would be more than willing to do that. We really are firm believers in getting this service covered by some program, like I mentioned, because ultimately, especially within the Medicaid waiver population, it's an underserved community for healthcare and assistive technologies like this. So we want it to be accessible. We don't want costs to be a barrier to the individuals served. So yeah, I would love connections.
Yeah, we're looking at our technology options now, so I would be happy to bring that to the table. And now,
wonderful.
Yeah, I'll let Jerry jump in here.
Yeah, Jerry, please.
Can't hear you.
I'm sorry, Jerry, we still can't hear you.
Zoom sometimes does that. It's not nice all the time, right?
You know what you can do, Jerry, is type your question in the chat and I'd be happy to read it out. So, I love that Kim has got all these connections that she could possibly. I think also when I was part of Lizette's meeting earlier, I heard that there were many people who could possibly reach out to the legislature and maybe find a way to address this. So that's exciting.
Very
Again,
cool.
that connecting pieces that we're doing. Is there anybody else online who, yes, Pat, here.
Alaina, great job. Your statement of the problem is spot on. When I was running the retiree population health plan for the state of Alaska, the data reflected that we were getting very poor compliance. And the medical community, we talked with them regularly about how to improve outcomes, and that was one of their great complaints. The tricky part was, who was going to call the person and tell them, hey, we got a bug in your medicine cabinet, and we saw that you failed to take all your meds today. So knock it off. And this is a voluntary thing that somebody invites in. I used a brand X, very simple solution with a battery operated timer for my mother, who is in hospice right now. And she was trying to live independently. Unfortunately, those days are gone, and she's getting full-time care right now. But it's a great idea. And since compliance does lead to lower health care costs in the future and better outcomes, it's compelling. I don't think your price is out of line. Probably, you know, what Marco mentioned, some way to pre-fill these is a good idea. Now, it was unclear to me, Wi-Fi or cellular, or is there an option for either one or both?
So we do have an option for either one or both.
Okay.
The Wi-Fi we've kind of sunset more so in Minnesota just because we have cell coverage. We have AT&T chips built into these, but I would imagine in Alaska we'd hit a lot of dead zones, so we could always bring back
I don't know.
Wi-Fi devices.
I think you'll cover most of the market. AT&T
Oh,
is
perfect.
widespread. Their cell towers are ubiquitous. And it doesn't appear to me to be high value or high bandwidth traffic. So I think that's okay.
Yeah.
I was going to suggest that Wi-Fi is always tricky.
Oh,
You
yeah.
have an end user, and then you have this coat of arms things where somebody is saying, it's their problem, not mine. Going with the cell one is a great idea. I'll give
Yeah.
it some thought and reach out to a few folks that we have in our stable that might be interested in
Wonderful.
So
seeing if
Pat,
they, and I believe they can really save money by adopting this for some willing participants.
Pat, would it be
Absolutely.
okay
Well,
if
thank
I
you.
shared an email introduction after this call?
Sure, please
Okay.
do. Thanks.
Wonderful.
I have Jerry's question right now, Alana. He asks, I have a lot of, he has a lot of background noise. Does this device tell the patient when they're taking, what they are taking at that specific scheduled time? Is it an educational opportunity as well? I hope I got that.
That's not
Yeah.
Jerry's question. That's Deanna's question, just to clarify.
Oh, perfect. Well, Deanna, that's a really great question. We can, we can honestly flex how we wanted to use it. So the device itself, it's pretty straightforward with just like it's going to sound the alarms at the scheduled time. We can turn alarms off to if it's going to be a trigger for somebody or if they're deaf or hard of hearing and they're going to be no use. But what I would say, and this is a service that I didn't talk about yet that we provide, is we do automated phone calls or text messages with literally any messaging to individuals. So we've used those for anything from like health reminders or activity reminders. And because that messaging can be anything, I think what we could ultimately do to kind of tie in what you're asking is almost automating a phone call or a text message to the individual at the same time that their machine would be opening up, that would say what they were needing to take, why they were needing to take it, whatever piece of educational information we wanted to put in there, we could certainly do that. And those automated calls can go to a landline or a cell phone. The text messages, obviously, you want that more to go to a cell phone. The landline cell phone versions aren't quite pretty, but and we can actually even set that up if somebody is going to respond better to maybe like the sound of a brother or sister's voice or their parent's voice or their daughter or son's voice. We can have that family member pre-record a message if they don't want to listen to my voice in the recording or an automated one. So that's a pretty flexible service that I think we could really tap into to help build on the device and make it an educational device essentially for somebody.
That is fantastic. So what I love is the flexibility and the ability to customize it for the needs of each person. Clearly, we could do some more, but we've run out of our time. So Alana, thank you very much for your presentation. Everyone, thank you very much. If you would like to learn more from Alana, just reach out to me and I will definitely provide an email introduction. Alana, I'll follow up with you as well afterwards. Everyone, thank you very much for coming today. Again, we have two other opportunities. We have the Mental Health Challenge meeting tomorrow at noon. Reach out to Kim if you'd like to learn more. And then on the 23rd, I really would love to have all of you come. And Alana, you'd be welcome to come back as well. But let's all just keep kind of sharing these creative ideas and making sure that we know all the latest and greatest things that we can support one another on. So thank you all very much, and I'm going to wish you all well, and thank you for participating.
Thank you, Jacqueline. Thank you all. Take
Thank
care.
you guys. Enjoy the rest of your day.
Thanks.
Thank you.